Where I'm going to go with this is your headache is pretty much your bellwether to most chronic inflammatory and sort of autoimmune worlds, as well as these pain patients. Headaches are kind of an interesting one because a lot of people kind of chalk them up. Yeah, 15% of all the people who get migraines and headaches, we just kind of used to it. But if you're in the low dose naltrexone world, you probably have you see a lot more of these patients because they're the ones that are coming to you. Headaches and migraines usually run in cycles with these patients who have these sort of chronic health illnesses, and you see them ramping up. And especially in these menopausal women, you see this sort of onset of migraines right through the postmenopausal state. And there's a discussion about too little progesterone. And yes, of course, we're going to address the hormones, but if they're continuing with headaches and migraines after, you have to start thinking about the inflammatory response that's going on behind the fact. In fact, if I have a patient who is suffering from any of these disease states that we would historically use naltrexone for, and we see an increase in headaches, usually to me, that's we've dosed too high. And so I didn't have it on that first slide that talked about side effects because I really want to use this as a standing point is headaches should be the first sign that your dosing is incorrect. In fact, you may either have to back down on dose or you have to titrate in slower for these patients. Because the headache is the first thing that people will tell you. Yeah, I started getting headaches. Yes, I started getting swelling. Oh, I don't feel well. That headache it's a very clear signal. It's just too much. In fact, there's more and more information that's going on about how headaches relate to these chronic disease states, and they can actually start pulling biomarkers on headaches, and especially during migraines. And we're seeing this overlap with so many of these autoimmune disorder patients. And so LDN is actually being shown in this paper. It was discussed. There's actually a second paper that was just published recently that talks about LDN being used for decrease of frequency and almost severity of migraines.